Welcome back. May is American Stroke Month, and it's important for all of us to know the risk factors for ourselves and for those that we care about. So joining us now are two leaders with Encompass Health Rehabilitation Hospital. Randall Hamilton is the CEO of the Savannah location. Wayne Boutwell is the CEO of the hospital in Bluffton. Thank you all so much for being here today.
Our pleasure. Thanks for having
Now, I
us.
should have included in your bio that you're a part-time model. You might have seen him walking in the Go Red for Women luncheon. So you're not, actually you didn't do that this year.
No.
Did you have too many fans after the last one or something?
Probably so. That must have been it.
Well, this is Stroke Month. Why is it important to talk about stroke?
Well, we find particularly what we do at Encompass in inpatient rehabilitation is that there is such a need for education and awareness. The prevalence of stroke is great. We find that globally 1 in 4 adults over the age of 25 are likely to experience a stroke in his or her lifetime. And yet, despite the prevalence, we still find that there is such a need for education, and many people just don't know what the signs and symptoms of a stroke are.
So let's talk about those a little bit. So we know there's an acronym that folks can use.
Absolutely. Yeah, the American Heart Association wants us to remember the acronym FAST. F stands for facial drooping, A stands for arm weakness, S is for speaking difficulty, and then T is for time to call 911. So if you see any of those symptoms, obviously we need to call 911 as quickly as possible because it can make the difference between a speedy recovery and or lifelong disability or even death.
So when we hear, I'm kind of confused about what a face droop might look like. How do you describe what that looks like? Is that an eyes? Is that a mouth thing?
It could be eyes drooping, mouth drooping, maybe some slurred speech, difficulty. It's kind of obvious where maybe some curving down. But you know, when family members or friends see that, they can usually recognize right away that this is not normal.
Okay, good. Look for abnormal behavior, abnormal signs there.
Correct.
So what are some of the things that we can control in terms of preventing stroke?
Sure. Well, there are some risk factors that you can't control, right? Like your age, your gender, heredity. But high blood pressure is one of the leading causes of stroke, and high blood pressure is one of the risk factors that you can have some control and some management over. So we recommend that you check your blood pressure often, have a good plan with your primary care physician to manage your blood pressure.
And those are that's something that people can do at home now, I
Absolutely.
imagine. Now, of course, if you want the professionals to do it, Encompass has programs for that. So you all deal in this space. What sort of things do you offer?
Yeah, both of Encompass Health of Savannah and of Bluffton are Joint Commission certified in stroke rehabilitation. We have specialized physicians, nurses, physical therapy, occupational therapy, and speech therapy. The basic goal is to get them at whatever level of care they need from that standpoint of maybe some of the weakness. They have right-sided or left-sided weakness. They're not having difficulty speaking. But work with them and work at rehabilitating them to get them to the best function possible upon discharge.
And is this something that where folks can just go to one of your locations, or do they need to be referred to you by another provider?
We can receive basically from patients from home. Maybe if they didn't have the referral from the inpatient hospital, they can call us directly and we can work with their community physician. Okay. I'm going back to the speech thing. They can speak directly with their physician and work to get that referral. But they can come from home or be recommended from case managers in the acute care hospitals.
Okay, great. We've got a few seconds left. I want to talk about how you all are working with the American Heart Association. You're really trying to spread awareness about this.
Absolutely. So we have found through our partnership with the American Heart Association that reaching out to the local churches and the congregations is a great way for us to get that education and that stroke awareness out there in our local communities. We've partnered with some churches locally in Bluffton. Our Savannah team is doing the same, and we have found that it's just one more way that we get to really partner with the communities that we serve.
Well, thank you all so much for being here. We appreciate this, raising awareness about stroke.
It's our pleasure.
Thank you.